Hi, I'm Wally Taylor, founder of Texas Integrative Medicine in Austin, Texas. A lot of my patients call me Dr. T. I've been practicing medicine for 40 years, and for about 25 years of that I've been practicing functional or integrative medicine. This was because I was running into patients with chronic illness and I just didn't have the tools in my Western toolbox to deal with them. This is part of a 3-video series on the kinds of toxins that I find that my patients with chronic illness are suffering from. Now, when I talk about chronic illness, I'm talking about diseases like chronic fatigue syndrome, fibromyalgia, chronic joint pain, chronic headache, chronic brain fog and memory loss, problems of the immune system, such as immune deficiency, problems of the hormones, digestive problems, such as irritable bowel syndrome. In a previous video, I talked about one of the big groups of toxins that affect my patients, and that was chemical toxins. Today, I'm going to talk about biological toxins. Biological toxins is actually a very big and important group of toxins that can affect us as humans. We're talking about at least 3,000 to 4,000 different bad germs that can exist inside of our bodies. It turns out that our concepts of the effect of germs in the body is dramatically changing just in the last few years. In 1884, Dr. Koch, a German, actually came out with a set of postulates where he described infectious disease or disease caused by germs as being one disease related to one germ. It turns out that that's not the case. Now, some diseases, yes, are pretty easy to identify with one germ. For example, strep throat. You can actually culture the throat and you can put it in a petri dish and you can identify that beta strep germ. But what I'm talking about is different. I'm talking about biotoxin illness that's basically caused by a large group of stealth pathogens. Stealth pathogens basically means germs that are much more difficult to identify. We do have a lot of different techniques that we try to use to identify them. One of the most common ones is to look at the immune system to try to identify whether or not the body is making antibodies against different germs. The problem with this approach is that oftentimes, as a result of toxins, even biological toxins, the immune system isn't acting in a normal way. And if we're depending on our immune system to tell us about the presence or absence of germs, we might not get the honest truth from our immune system. What's happened though lately is we've developed some new technology just in the last 10 or 20 years called DNA sequencing. We use a technique where we can amplify or increase the number of genes in a sample, say a blood sample or a urine sample or a cerebrospinal fluid sample, and we can then amplify all of the DNA and RNA material in that sample. Then what we can do is actually sequence that material. That means to identify the exact A through Z writing of that sequence, and we can compare it to what's known about other germs and just do a matching technique so that we can identify the germs in the body. This is making it much more reliable that we can identify some of these stealth pathogens. Unfortunately, this still has a long way to go, and it's very difficult to identify many of these pathogens, again, why we call them stealth pathogens. But it turns out that along with the chemical toxins and another group of toxins, the physical toxins that I'm going to talk about in an upcoming video, it's a combination of all of these different environmental toxins which together lead to this group of symptoms that I identified earlier in the video. It's like a soup, if you will, and it turns out that each one of us has a different sensitivity to the toxins. Some of us are canaries in the coal mine, which means we're exquisitely sensitive to the toxins. Other people not so much. An interesting thing about stealth pathogens is that we know now that there's a lot of people that carry many of these stealth pathogens and have no chronic illness at all because their bioterrain is such that they're not particularly sensitive. One of the worst biotoxins that I encounter in my practice almost every day is mold. Now, mold can be indoor mold. It can be on foods such as cereals, grains that have been stored in silos. But many of these molds can cause two problems. They can either cause direct immune inflammation or a so-called allergic reaction, but in addition to that, many of these molds will create some very, very toxic small molecules called mycotoxins or mold toxins. And it turns out that many of my patients have lots and lots of symptoms related to these. In addition to mold toxins, which is one of the first things we look into with our patients, we also know that viruses such as the monovirus, the chickenpox virus, other herpes viruses, parvoviruses, CMV, literally hundreds of viruses can also exist in the body as stealth pathogens or stealth infections. In addition, a number of yeast and molds, one of the most common ones being Candida, which many people have heard about, seems to exist particularly in the digestive tract, but also parasites. Parasites turns out to be a very under-recognized source of pathogens in many of my patients. And I'm talking now about single-cell pathogens like Giardia, but in addition we're talking about multicellular organisms, even so-called worms, such as tapeworms or roundworms. But again, for these biological toxins, it's almost always a combination. And one of the things we've learned is that some of these biotoxins that are in our bodies will actually give off certain molecules or chemicals that have a direct toxic effect on our cells, tissues, and mitochondria. But I think even more important than that is the fact that our immune system, even if it's not perfectly normal, tends to recognize the presence of these bad stealth pathogens and begins to react in what we call an immune response. And the immune response actually generates mediators of inflammation, which in many cases will actually lead to many of the symptoms of chronic illness that you are probably suffering from. So it's the immune system that is at the root of much of this. And it turns out that the immune system, the role of the immune system is to help us. And we find that even though it's not maybe functioning in a perfectly normal way, maybe it's dysregulated, it's either overactive or underactive, we find that the best thing to do is not to turn off the immune system, which unfortunately leaves the bad germs undefended, but instead what we find is that we want to enable the immune system so that it can adequately deal with the pathogens but not end up causing as much immune self-injury. I use the concept of friendly fire in the war. The immune system is like the good guys, and when they start shooting at the bad guys, sometimes we can get shot in the crossfire. But I don't think the best answer to that is just to quit shooting. It's to learn how to direct the shooting more at the biotoxins. So if we see you with these symptoms of chronic illness, we're going to consider the biotoxins, and we're going to utilize a series of tests when appropriate, but also just good clinical information to try to get us in the ballpark of which of the toxins you're dealing with. And what we've learned is that if we can lower the toxins, and in some cases we cannot completely eliminate them from the body, which would of course be ideal, but we have learned that if we can dramatically lower the counts of many of these biological toxins, you will see dramatic improvement in your symptoms as we go along. So we look at the biotoxins, we look at the chemical toxins, and I'm going to talk a little bit in an upcoming video about the physical agents that we also deal with. And so I would like to ask you to subscribe to my YouTube channel, or to go ahead and go to my website, Texas Integrative Medicine, texasintegrative.com. If you're interested to come see me or one of my colleagues in my practice, we have a collaborative practice where we bring in a number of providers that have various degrees of expertise in the areas of these environmental illnesses. But I would ask you to call 512-800-5309, and I look forward to working with you with your individual problems of chronic illness related to these environmental exposures. Have a great day.
Medical disclaimer and legal stuff.